All right, and now I'm going to auscultate with the diaphragm. And then the bell. Something I forgot to mention during the part of the lung assessment was that if I had heard anything abnormal during the lung assessment, I would have gone on to do egophony, bronchophony, and whispered pictoriloquy. So now back to the cardiac. If I had heard anything abnormal with the cardiac assessment, I would sit the patient upright or turn them on to the left side to bring the heart closer to the chest wall. Also, I need to mention that S1 is the closing of the mitral and tricuspid valves, and S2 is the closure of the aortic and pulmonic valves. A systolic murmur would be heard after S1, and a diastolic murmur would be heard after S2. Now I'm going to go and I'm going to palpate and auscultate some of the arteries. So first I'm going to palpate the temporal arteries, and then we're going to auscultate the temporal arteries. Okay, then we're going to palpate the carotids and auscultate them as well. Okay, now we're going to palpate the other carotid and auscultate. And you're looking for thrills or bruits. Now I'm going to just palpate some other arteries. So we're going to do the brachials. Okay, we're going to do the radials. We're going to do the popliteals. Okay, we're going to do the posterior tibialis. And the dorsalis pedis. Okay. Next we'll go on to the abdomen. We'll inspect the abdomen for any kind of waves of peristalsis or stria, abnormalities, masses, anything visible. Then we auscultate the 4 areas. Then we percuss. And next we're going to palpate lightly. Any pain with palpation?
No.
All right, and then we're going to do deeper palpation.
A little bit there, yeah.
Okay.
A little bit of pain in these areas.
Okay. Then we're going to feel for the aortic pulse and check the aortic width. with deep palpation. Okay. Something I forgot to do was check the sensation in the face with cotton ball, which I'm going to do with him laying down. It's a little unorthodox, but this is how I'm going to do it. All right, so I'm going to touch you with this and let you know what it feels like. This is testing one of your facial nerves. So now I need you to close your eyes. Tell me when you feel it.
Mm-hmm. 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 Mm-hmm.
Okay. All right, so I've completed the abdomen. Now we are going to go to musculoskeletal. We're gonna do the hips. So let's do hip abduction and adduction. So take your right leg and swing it outward. Okay, and now crisscross it over your left. That's abduction and adduction. All right, put that one down. Now do the same with your left. Out, in. Okay, we're going to test internal and external rotation. So lift your right leg, put your foot on your left knee, and rotate out your leg. That is external rotation. Okay, now we'll do internal rotation. So put your foot on the bed, and then turn your, there you go. All right, so now we're gonna do the same thing with the other leg. So take your left foot to your right knee, put your left knee out. That's external rotation. Okay, come back up, put the foot on the bed, and then pull it in here. Okay, that's internal rotation. All right, and then put your leg straight. Now we're gonna test flexion. So right knee to chest. Okay, now let's do left knee to chest. All right, and we will do hyperextension of the hips when I have him standing later. Now we need to do hip strength. So pull up against my, all right, and then strength on the left, same thing. Okay, now I'm gonna have you sit up. You can sit aside. All right, now we're gonna do the other musculoskeletal system. So I'm gonna check his joints for any kind of inflammation, masses, any other kind of abnormalities. We're okay. We're going to do the neck. So flex forward. No, not like that. Chin, tuck the chin. So that's flexion. Now backwards extension. All right. Now I need you to laterally rotate. All right. That way. Okay. And now chin or ear to shoulder. All right, and now we're going to do strength. So push against my hand. Okay, and now pull against my hand. Okay, and something I forgot to do in the nerves, we're going to do one of the other facial nerves. So we're going to do lateral turning. We just showed lateral turning, so do it again. This way and that way. All right, that way. Now we're going to do it against my hand. So this tests one of the cranial nerves. Okay, now shrug your shoulders and down, and now against resistance. So that's a cranial nerve. That's a little bit out of sequence, but at least I remembered. Okay, we did the neck. We're going to do elbows. So flex the elbows up, okay, and extend them down. Okay, now we're going to do pronation and supination. So supination, pronate. This is internal and external rotation, so back up. Okay, now we're going to flex them again because we're going to check your strength. Now push against my hands, and now pull against them. Okay, so that's elbows. Now we're going to do wrists, so flex your wrists, hyperextend them. Okay, and now flex against me. All right, push against me. Okay, so that's the wrists. Now we're going to do fingers, so flex your fingers inward, extend your fingers, and then we're going to check grip strength, so squeeze. All right. We're going to do knees next, so we're going to flex, well, extend your knees. It's going to come out, do one at a time, okay. Do this one, okay, and that's flexion. Now do it against gravity. Okay. All right, and that's your strength. Now we're gonna do feet. So plantar flex, which is towards this floor, and then dorsiflex up. All right, now we're gonna do the same. So put your feet back in a neutral position. Now plantar flex against to check your strength, and dorsiflex. Now I need you to invert your feet, so they're gonna come in, okay? And now evert. All right, that's all the musculoskeletal. We're going to check joint vibration. Okay, I'm gonna activate this and put it on a couple of your joints. Just let me know if you feel it.
Mm-hmm. Mm-hmm.
Not very good.
Oh yeah.
Okay.
Mm-hmm.
Okay. Not very good at this. All right. Feel it? Or am I not on the joint?
Yeah, I can feel it.
Okay.
So it's minor, but I can feel it. Mm-hmm. Very minor. Mm-hmm. Mm-hmm.
Okay. Let's do vibration. Now we are going to do deep tendon reflexes. Okay, we're going to do the brachioradialis. No, this is not brachioradialis. Brachial first. All right, so just put your arm like this. All right, ready? I'm going to strike my thumb and try to elicit a response. And, okay, we got that one. We're going to do the other arm. Same thing. Okay, we elicited a response. We're going to do the elbow. So just relax your arm. Okay. Okay, we got that one. Same thing over here, relax. Got that one. All right, now we're going to do the brachioradialis. So just relax. Okay. Did I get it?
Mm-hmm.
Okay. Now we're going to do patellar. Okay. I'm going to do the other patellar. All right. We're going to do the Achilles. Okay. And do the other Achilles. All right. Then we're going to do Babinski reflex. That didn't really work very well because, let's see. Yeah, it didn't work well enough. All right. Okay. A little bit. Try it again. All right. That's all of our reflexes. I'm trying to think what else I needed to do. We need to do gait, and we need to do vertebral column. So go ahead and stand up for me. Now we need to do hip extension. So bend backwards this way. Oh wait, no, that's vertebral column extension, sorry. So bend back from the waist. All right, now bend forward. That's going to be flexion of the vertebral column. Now I need you to turn this way, and then kick out your right leg behind you for hip extension. Okay, and do the other one. All right, now we are going to check your balance. So put your feet together, all the way together, all the way together, and close your eyes. All right, Romberg test for balance.